This is me, Dr. Puja Dewan, your gynecologist whom you're going to meet each time in the show. The old adage, prevention is better than cure, shall always stand true. So the discussion today is about breast cancer screening and prevention. Examine your own self. Self-breast examination. If you think there is a trouble, go to your doctor and get clinical examination by the doctor. And if the doctor advises, as per routine, you can go and get done screening. Screening through methodologies like mammography, ultrasonomammogram, MRI of your breast. There's a whole bundle of them. So, when you examine your breast, you need to examine your breast, examining the deeper tissue, both the nipples and the breast tissue, and also the tissue under your armpit. That's the axilla. Now, how do you examine? You examine yourself standing in front of a mirror. Observe yourself, feel yourself, touch your breast. You lie down, and that's a better way. In addition to standing, you have to examine yourself lying down because you can feel the breast tissue better and deeper. You could do that casually in front of the mirror in your washroom or even under a shower. Now the question is, when do you examine? You examine 3 to 4 days after you have finished your menses. And how frequently? Every month, obviously. And when do you start? Well, from the very time you actually get well-developed proper breasts, the moment you are a woman. There are warning signs to pick up breast cancer. You may feel that there is pain, or you may feel there is itching or irritation in your breast skin. But when you look into the mirror, you might find that there is a change in the breast size and shape. One breast could suddenly become smaller, the other could become larger, the nipple may get deviated, it may move inwards. When you look at your skin, you may find that there is redness, there is a rash, there is a darkening of the skin. You might find that there is a kind of bump or swelling. Your skin may actually look like the orange, like a pudy orange appearance with a little bit of edema and puckering spots. Also, when you look at your nipples, you might find that it's become red, it's become flaky, it's become itchy. And when you press your nipples, which is a must, you must always press your nipples to see if there is any discharge which is except whitish discharge, which could be milky, is of suspicion. There could be frank blood coming out of your nipples. There could be a greenish discharge, yellowish discharge, and you must always examine your breast with your own fingers. You might feel a lump which could be as small as a pea or a bigger lump like the size of a tennis ball. You must always examine your underarm because the tail of the breast goes into your armpit. I assume that you would be examining your breast every month. So when should you go and see your doctor to get clinical examination of the breast done by your gynecologist? From the age of 20, every 3 years should be the routine for you to go and visit your gynecologist, and once you turn 40, every year. So when do you get your mammography done? There are various schools of thought. Some say that the age to begin mammography is 40 and the others say it's 45. But for sure, once you turn 45, you should go and get mammography done every year. When do you stop getting the mammography done? They say that as long as you're alive. The other school says till the age of 75. And then there's another school which says that whatever is the life expectancy in your population, 10 years before that you could stop. Now with increasing life expectancy and with the second wave of breast cancer happening between the age of 65 to 69, you can't stop as soon as that. So please get the breast mammography done for as long as you can. Contact your doctor. There may be tailor-made solutions for you. There may be do's and don'ts individualized for you. Mammography is not a pleasing word for many women to hear. It brings in feelings of discomfort and having to bear yourself in front of a stranger to get a test done. For many, it's an experience of extreme pain because your breasts are pressed and compressed between two plates. Let me assure you that the modern technology does not cause that kind of discomfort, and the expertise level itself has changed. So how do we benefit from a mammography? If you cannot see a lesion, if you cannot feel a lesion, mammography will still pick up a lesion even at a microscopic microcalcification level. There are definite benefits. Now, mammography has a scoring system which is called BI-RADS scoring. 0, 1, 2, 3, 4, 5, 6. 1 means there is negative risk for cancer. Now, there is nothing known as negative, but that's a calculation. 2 means that the lesion that you have is non-malignant and benign. 3 means it is probably benign. 4 means that it is suspicious of a cancer. 5 means it is highly suspicious of a cancer. And 6 means there is frank malignancy cancer. Now, I started the scoring with 0, 1, 2, 3, 4, 5, 6. So, if you have a score of 0 and 1 means negative, then 0, does it mean that it is so reassuring that there is absolutely no probability for you to have a cancer? No, I must warn you that a 0 score means that mammography, when done, has an inconclusive report to share with you, and we need to add certain other modalities to find a conclusive answer to your BI-RADS scoring and your breast cancer risk. And most commonly, and the easiest modality to add on, is ultrasound of your breast. Both the breast ultrasounds take place, and this is known as sonomammography. So besides mammography, there is ultrasound of the breast and MRI. Amongst them, of course, MRI is the most expensive. So when do you do an ultrasound of the breast? You do that when there is a lump, either in the breast or in the axilla, and you want to know the true nature of that lump. Add to it a situation as a first modality of choice. If you are a pregnant or a lactating woman and you have a breast lesion, then you do an ultrasound of the breast first, and then you go and look ahead for any other modality. MRI is the most sensitive to be able to pick up the smallest and the most confusing microcalcification lesion. But in routine parlance, it is not that commonly used, but its USP is that in case there is a breast abnormality which is suspected, particularly in a woman who has breast implants in her, or if you've had breast cancer in the past and there is a resurgence which we are suspecting, especially along the line of the previous surgery scar, then MRI is one amongst the best modality. All three modalities are non-invasive, as in no needle is put in them. They are safe, and in case there is a lesion that we have found, if there is a lump we have found, then we can identify the lump with the help of an ultrasound, and we can put a needle inside of it to biopsy it. This is an ultrasound guided biopsy. Now this biopsy can be done with a fine needle which is known as FNAC, fine needle aspiration cytology, and it can also be done as a true cut biopsy, which is a slightly bigger chunk and a deeper chunk. It gives you more tissue for a more reliable diagnosis in one go. Of course, a true cut biopsy today has higher sensitivity and specificity than a FNAC needle. MRI based biopsy can also be done. I wish you all good health, stay safe, see you next episode. Goodbye and thank you.